And today we've realized that for those of us who, when we are talking, there is whitish fluid coming from your mouth. It's not saliva, very white and very thick. You need to consult your doctor. And for those of us who normally have cracks on the lips, you need to consult your doctor. Today we've learned a whole lot. Now Dr. Sumaila from Amen Scientific will be telling us the effect of candidiasis, or what we call whites. What are the effects?
Candidiasis, when it goes untreated for a very long time, is likely to result in what we call invasive candidiasis. That is the candida infection getting into your bloodstream. When it happens, it's called invasive candidiasis or candidemia. When it happens that way,
it is working like cancer, because we know if you get cancer in your finger, that cancer can travel and spread throughout.
Yes.
Then it means candidiasis is equally dangerous.
It's a very dangerous medical condition. Candidiasis, when it happens like that, candidemia, like I told you, affects the bloodstream, and then the infection spreads to other parts of the body, because the blood happens to travel throughout the body. It's quite a dangerous condition, and it's more difficult to treat than vulvovaginal infection, or than the oral candidiasis or thrush, or even the diaper rash that people will be having. So candidemia is the severest form of candidiasis that somebody could have, and it has that consequences for the body.
I saw pictures of women with candidiasis, and I was like, is this the thing I like the most? Like, you understand? The effects.
What we know is, because candidiasis normally come along with other sexually transmitted infections like gonorrhea, chlamydia, trichomoniasis, and syphilis, and so on. Usually, those other conditions are likely to cause problems with fertility, especially for women, because when gonorrhea, chlamydia go untreated for a very long time, sometimes these infections could cause blockages in the fallopian tubes of women. That makes it very difficult for them to conceive.
Seriously?
Because the fallopian tubes are blocked. So when fertilization occurs in the fallopian tube, the zygote is not able to travel the length of the fallopian tube into the womb for it to be implanted in the womb. So you happen to see that most women are likely to have ectopic pregnancy when candidiasis comes along with other STIs, or they could not have pregnancy, or they could not be pregnant at all.
And
because
it can also spoil marriages, because if you're a young girl, you have candidiasis, every man who comes around you knowing that this is what is worrying you will not stay.
Yes, especially with the offensive smell that comes with it. People with candidiasis
smell bad.
Yes, have to take their personal hygiene as a priority, because when these discharges occur, it is clumpy, it's thick, you understand, and then it stays underneath, and you know the place is always covered, and there is warmth. These are all the factors that lead to the production of offensive smell, and so it's very, very embarrassing for those women. That is why we encourage early treatment. Women who see or who experience these symptoms have to get to any nearby medical facility for them to be diagnosed properly and then be treated, because when they stay for a very long time, we've all realized what it could do, that it could even get into our bloodstream and cause a lot of havoc to the body.
If you're a man and you have too much sex, everyday sex, you are going to get stroke. How true is that?
No. Then our parents, our forefathers, all of them would have gotten stroke, because you see, at that time their source of entertainment was sex.
26 years dying within 24 hours.
By anatomy, it's located between the penis and the urinary bladder.
So far as a hospital we are concerned, and as a country, all the suspected Ebola cases were proven to be negative. So why would people link cholera to Ebola?
We talk to them to be pulling the nipple, so that by the time of delivery, the baby will be able to suck and then get the breast milk.
na wa yete so bodam ni yare enye se papa ho ayi ho nko an e kire se wa bodam
bebi na to chima o baby And a man by 25 years, no fibroid.
Out of the 171, we have 5 deaths.
Yes, men too stand a risk of having breast cancer.
When you have orgasm, what you see with your naked eyes is produced by the prostate.
If I'm sick, I cannot be here asking you questions regarding cancer.